My little boy Hudson, he was very iron deficient and he was always tired. Anyway, when we got him on iron, he grew an astronomical amount. So I'm giving away my tips now why Huddy's so big at basketball.
You're listening to Parents You've Got This, the expert guide to parenthood. The complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Thanks so much for tuning into the Expert Guide to Parenthood podcast, a podcast which is all about parenting and pregnancy, fertility and birth. So if you have a question, well, we have the very best experts in the business here to give all of their advice about all of those topics that guide and support you on your journey. Today is one that may be facing your little one. Maybe they're iron deficient. What does that look like? Or maybe they're tired, grumpy, maybe they're complaining of a headache. Well, we have the expert here today to talk to you about this problem.
We are joined today by Dr Lexi Frydenberg, who is an experienced general paediatrician specialising in the care of children and their families up to the age of 18. Lexi is a parent, she is a fellow podcaster, and we are absolutely thrilled to have her with us. She is dearly loved by our team. Lexi, thank you so much for being here today.
Thanks for having me again. It's been a while.
It has, far too long. Now, let's talk all about iron. Lexi, why is it such an important mineral?
So iron is a tiny mineral, but it makes a big difference. So iron is, we think of it as the fuel that takes the oxygen around the body, and it's really important for growth and development, particularly in young kids and infants in their brain development, but it's also really important for the immune system. So it has many vital roles.
So what then is iron deficiency?
So iron deficiency is when there's not enough iron in your body to support all the work it needs to support. And as I said, that ends up with poor growth and development in particular. So we really need iron. It's an essential mineral. And if we don't have enough, we become deficient.
So what are the symptoms, Lexi, of iron deficiency in babies and children? Obviously, as our children get older, they're able to articulate things a little bit better. What are some of the things that we can look for in babies and children?
Yeah, so in young infants, in babies, it's a bit harder. They might just be off their feeding and they might have some poor growth. In the toddlers, they might have trouble concentrating, although many toddlers have trouble concentrating, but they might be more fatigued, more tired. They might look pale. They might be grumpy or irritable, but once again, many reasons why toddlers are grumpy and irritable. And in our older children, once again, it can affect their growth, so their weight and even their height if it's quite severe. But it can also affect their brain development, so their learning, their focus, their behaviour. And as I mentioned earlier, the immune system in children of all ages.
Yeah, well, my little boy Hudson, he was very iron deficient and he just woke up. He had big dark bags under his eyes, even though he'd gone to bed early. He was always tired and he wasn't eating really well at all. He'd gone off his food. Anyway, when we got him on iron, he grew an astronomical amount. So I'm giving away my tips now why Huddy's so big at basketball. But he grew an astronomical amount and he was just pepped up, like he changed his whole personality and way of being.
I think that's a really important point, Christy. It's not something that happens overnight. You might notice it overnight, but it's usually been there for a while because we have iron stores, and it's only once those iron stores drop and you become deficient in iron that those symptoms might develop. So it's usually if tiredness has been there a while, not if they just wake up one day tired. But, it's really important because parents, you're probably the first people to notice it and ask for it to be tested.
Yeah, definitely. He was always tired. That was the thing, like always tired. So how do we go about getting it diagnosed for a child?
Yeah, so if you suspect it, if your child is tired or pale, or if they've got a pretty poor fussy diet, they're not having a lot of iron-rich foods in the diet, the only way to tell if your child is iron deficient is to have a blood test. So go to your GP, tell them the story, and then they can organise a blood test. And usually that's something called a full blood examination. We look at the haemoglobin, the red blood cells that carry oxygen around the body, and we look at the ferritin, which is an indicator of what our iron stores are. it is important to know not to have that blood test done while your child is sick, because if they've got an infection, a virus, common cold, the ferritin can artificially go up, so it becomes very hard to interpret.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyou'vegottthis.com.au and sign up for a masterclass today.
Lexi, how can we actually prevent iron deficiency? What are some things that we can do to give our children the best chance of not developing an iron deficiency?
Yeah, so in breastfed babies or in younger babies under 6 months, we don't often see iron deficiency. They've got enough iron stores. But once those iron levels start dropping at about 6 months, that's another reason why we introduce solids between 4 and 6 months. And the diet is the best way to prevent iron deficiency. So iron-rich foods, and you can Google it and have a look, and there are lists of what iron-rich foods are. But in the younger kids who you're just starting on solids, iron-fortified cereals can be really helpful. You can get iron-fortified breads. But as most of us know, red meat is the best source of iron. So, get your child to chomp on a lamb chop if they're able to chomp and swallow it. Mince is really good, but also non-red meat, so chicken and fish are really good. But also legumes and beans, tofu, as well as green leafy vegetables. We all know about Popeye and spinach. You have to have a lot of spinach to prevent iron deficiency, so I wouldn't rely on spinach alone. But as I said, there are the meat products, but there's also, for vegetarians out there, they can still maintain their iron levels. They just have to be very cautious and very diligent about the foods you give your baby.
Yeah, and so what are some of the treatment options if we discover that our child is iron deficient?
Yeah, so I think, as we've mentioned, diet is the first port of call. So really taking a good diet history, keeping a food diary for a week, and thinking about all the times you could add a bit of a few iron-rich foods into your child's diet. One thing that there are 2 tips about diet. So if you give iron-rich foods at a similar time that you give vitamin C, so a mandarin, an orange, some Ribena, it increases the absorption of iron. So that's tip number 1. The other tip is that milk can decrease the absorption of iron. So in the younger kids, we often see in the toddlers iron deficiency because they're predominantly on milk. Yeah. So, we see kids who are having 2 litres of milk, and they need less than 500 mils of milk for their calcium supplies. So we really talk about limiting the milk intake, increasing the iron-rich foods, giving them the same time as the vitamin C. So diet is number 1, but if your child has had that blood test and has shown to be deficient of iron, then your GP will recommend iron supplementation. And it comes in liquid form for the younger kids and in tablet form. So in Australia, the common liquids that we have, there's one called Ferroliquid, one called Multifer, and they're both over the counter, but they contain enough of the elemental iron to replace that deficiency. In the older kids who can swallow tablets, or adults, you might have heard of Ferrograduate C, which is just a tiny little tablet. Multifer also comes in a tablet form, but there is also something called a Phe-Fol Spatial. So Phe, Fe, is iron, Fol is folate, so it's a combination of iron and folate. And we can use that in kids of all ages because you can open up the spatial and it's got little sprinkles, and you can sprinkle those in their food or on a piece of bread with hundreds and thousands. Just to sort of a heads up, I don't know if your son felt this, but the taste isn't great. I often recommend to parents, just try something before you give it to your kids, just a little bit, because you'll work out why they tend to spit it out.
Tastes like metal.
It really does taste like metal, doesn't it?
Yeah.
The different products taste different to different children. And, initially it is hard to get iron into many kids, but I think our role as a parent is to encourage them, support them, be positive. Give it initially with some, chocolate topping or some hundreds and thousands, put it in some ice cream until they get used to it. But it is something they're going to need to take for at least many months, so you do have to be persistent but never force them.
Yeah, and I think once Hudson got a little bit older, so he was like 8 when he sort of started on it, he realised, I was like, this is your growing one. This is the one that's going to make you faster, going to make you less tired. And he notices it himself. Like if he forgets to take it for like a few days, he starts to feel tired. So I think that sort of really helped him. And particularly now he's like towering over everyone else. I'm like, come on, we need to keep up the tower. You've got to have your iron.
And if you have symptoms due to that iron deficiency, so if you're really tired and lethargic, often that will improve within 1 or 2 weeks of taking the iron. And people are tempted to stop it then because they're like, oh, I feel better.
Yes.
But actually you need at least 3 months to bring those iron stores back up to a level, because otherwise they'll dip again.
Yeah, and I think too, another tip for parents is to include it into something that you do every day. Otherwise it's so easy to forget, so make it, that you always have a glass of orange juice, with your breakfast and your iron tablet after you've had food or something, so you're not going to forget it.
Yeah, and you can give your child options, because most children don't like to be told what to do. So give them some autonomy. You can say, would you prefer your iron in the morning or at night? Would you prefer orange juice or would you prefer, Ribena? So give them some options, but the non-negotiable is that they need to take their iron.
Yeah.
And are there any side effects, Lexi, from taking iron supplements?
Yeah, so as we know, every medication, but also many over-the-counter medications like these, do have side effects. The most common ones are gut side effects, and they're often early when you start taking the medication, and they settle down. But some children complain of tummy aches or nausea. It actually can cause constipation or make constipation worse. So I always tell my patients, if your child is constipated, get on top of that before you start the iron. But there are many things we can do to help that constipation, and in some cases we actually move to second daily instead of every day taking the iron, and that can help. And the surprise one that many people get a bit of a shock with is it can make the poos go black. So, we often have kids yelling, my poo is dark and black, and it's the iron, and that's normal and that's to be expected. So yes, there can be side effects, but usually once your body gets used to it, they can be tolerated.
You mentioned that, it takes about 3 months to sort of start to get those supplements working. How long does it last for? Like, are they on those tablets for life or?
Absolutely not. So our goal is to bring the iron stores back up to a level, and at the same time try and work out why your child is iron deficient in the first place, because if you don't actually treat the cause, you're just going to be band-aiding the problem. So when we start iron treatment, we would often repeat a blood test in 4 to 6 weeks if they've been quite low, to check that we're on the right path and the levels are coming up. But then you need it, or your child will need the iron for at least 3 months once the levels have come back to normal, to replace those stores. Also, at the same time, you need to address the cause. So if it's diet, which it is in many of our children, decreasing their milk intake to less than 500 mils a day, as I mentioned in the toddlers particularly, trying to increase iron-rich foods in their diet, really essential. And, we often see iron deficiency in teenage girls. That's the other big group who start having periods because we have blood loss. So you need to address the periods and sometimes, the length of period, the heaviness of period. So don't forget to address the cause rather than just treat the problem.
What about iron infusions, Lexi? I remember my 3-year-old had an iron infusion, and it was life-changing for him. He just became a different kid. I think with Christie's Hudson, he was able to verbalise the difference it made for him, but Harry couldn't. It was amazing. Can you talk to us a little bit about when iron infusions are needed and how that works?
So iron infusions are quite controversial in children. So I don't hear of many 3-year-olds having an iron infusion. And the reason for that is because oral iron works so well. You don't have to replace the iron quickly. This has usually been a problem that become deficient over time. So you have time to increase those iron levels. And sometimes if you keep giving infusions, you need to repeat that. And it's a big procedure and it has its complications. So if you are going to have an iron infusion, it needs to be done in a supervised medical or hospital setting, because the 2 big risks are allergy or anaphylaxis to the iron and what we call extravasation. So an intravenous drip is put in, the iron is infused, but if it actually extravasates or goes out of where it's meant to go, it can cause permanent staining on the arm. So we really do limit iron infusions in kids. I know that we hear about a lot of adults getting them more easily, but I would always say definitely try your oral iron first. The cases where we do admit children for sort of half a day to give iron infusions are if we've tried the whole gamut of oral iron and we're still not winning. And that's particularly with some of our children with autism spectrum disorder who have a lot of sensory aversions, and we really, really can't get that oral iron in. So that's one reason we admit children, and we often need to give them some sedation to do that iron infusion. But also if you have an underlying gut problem that's not going to absorb the oral iron. So a child with celiac disease might not be able to absorb oral iron, so we may need to give an infusion. But as I said, even amongst the paediatricians and haematologists in Australia, you know, there are some who do use it readily and others who never use it. So it is a controversial topic.
Well, Lexi, as always, we love having you on the podcast. Parents, if you want more information with Dr. Lexi, we've got a whole host of episodes with her, so check out the Expert Guide to Parenthood podcast library. Also, you might want to come to one of our masterclasses. We have a whole host of masterclasses and an amazing website at Parents You've Got This, and check out our socials for lots of tips and tricks from Lexi about all the topics that you may face in parenthood.
A huge thanks to Mistela for sponsoring this episode. When little ones suffer from iron deficiency, their skin can sometimes become dry or more sensitive. Mistela offers a range of moisturisers to suit every skin type. Made with natural ingredients and dermatologically tested, Mistela helps to keep your baby's skin hydrated, protected and comfortable every day. Mistela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.